Hi everyone, very good afternoon, guys. I hope I am audible and visible to each one of you. Well, today we have another session that we have planned, and this is going to be again as we were doing in the last week. We are continuing on the same, on the same basis, and this is primarily going to comprise of two things. So, first, we are going to have a session right now from 2 o'clock for approximately 25-30 minutes. Let's say up till 2:30 p.m. we'll have a session that will be on the YouTube channel, and after that, at around 2:40 p.m., we'll be meeting on the open house session. An open house session is going to be on the Unacademy app. Now, till last week, all of you are aware that when we were doing the open house sessions, we were talking more about strategy and queries that the students had about how to study and whatever obstacles they were facing. But I've tried and I'm trying from today onwards that we should have open house sessions where we can study and where we can use the audio way of learning also, because we are too dependent on seeing and studying. Visual way of learning, audio way of learning is also a very good way which can enhance your memory to a great extent. So what are we planning? What have I planned is, how are we going to go about it? I'll be circulating one PDF right after this class. Yes, right after this class, I'll circulate the PDF beforehand. That's the plan, because you're hearing to me, right? In that hearing me out in the audio session. So you should have something, some paper, some text material in front of you. So right after this class, I'll share the PDF first over the Telegram groups, my Telegram group and the Unacademy group. So first I'll share the PDF. You guys download the PDF and keep that in front of you. And when we have an open house session, it will be more like a chanting session. So, for example, the topic that we are going to do today are the very tough ones, that is the CD markers that we have. So, how are we going to learn the CD markers? By repeatedly saying it out again and again. So for 20-30 minutes we are going to sit down with all the CD markers. First we learn all the CD markers, and after that we are going to do a small test kind of a thing of the CD markers. Obviously you will not have anything to answer, so don't worry that if I join someone's going to ask me a question or anything. It's more or less that I would be talking, but I'll tell you ways, tips and tricks of learning these CD markers. So that will be a PDF in front of you, and then obviously on the open house I'll be telling you, and it is open to any queries that you have. You can always raise your hand, ask your queries. That all remains the same, right? So let's see this. Let's try it out today. If you feel that it works and it helps you learn, we can have more sessions. So I've planned 2 sessions. आज भी यही है 2 to 2:30 YouTube, and then after that open house. Same pattern tomorrow also. So first let's start with the YouTube session. YouTube session में क्या करना है 2 दिन. Today there's a very short session. These are all the RBC different things that you can get. I've divided it into 2 classes. The problems that you can get in the RBCs in terms of the shapes of the RBCs, and the problems that you can get in terms of inclusions of the RBCs. तो आज हम पढ़ेंगे inclusions. Today what are the different things? Like you can see there are some things that get accumulated inside RBCs. All of those we are going to study today, and tomorrow we will study the shapes wala part. So let's begin. If I broadly have to classify, this is a table which is very famous, given in many standard books, but overall so much of text is there in this table that it's very difficult. You can barely read it also. तो ये वो सारी चीजें हैं जो हमें पढ़नी है, तो it's better we take it up one by one, right? So let's see, let's take it up one by one. So I've got 1, 2, 3 pictures in front of me, and let's see that what all can I differentiate between them. So let's start from this. So look at these 2 pictures, guys, the 2 pictures that I've labeled over here. If you see the overall color, look at the red blood cells, look at the color of the red blood cells. You will say that, ma'am, Acha, before I begin, some of you are saying that the video seems to be a little blurred. Just change the quality settings at your end and it will be sorted. At my end, it's the highest resolution that is being portrayed. Just change the quality settings at your end of the live streaming and set it to a higher quality. You will be able to see the video in a better resolution. Okay, so when you look at these 2 pictures and you look at the color of these 2 RBCs, one thing is very, very certain is that it's got a pinkish color. Yes, it's pinkish. The red blood cells over here and here are pinkish. Why? Because red blood cells have hemoglobin, right? And that is what is the color that you get when you stain a red blood cell with a Romanovsky stain. When you stain it with a Romanovsky stain, this is exactly what we are going to get, okay, the reddish tinge. Versus if you look at the third picture over here, the one in the corner over here, this has a, if you see the red blood cells, you'll say that ma'am, they are looking very gray, very dull, because a different stain has been used over here, and that stain is known as the crystal violet stain. So first and foremost, stain, knowing the stain is very important. When I see red blood cells as reddish, pinkish, hemoglobinized Romanovsky stain, when I see them as a little dull, then I've used the crystal violet stain. Now let's see the bodies. So one by one, let's go. Let's go in the first picture. Can you see that every red blood cell that I'm encircling, every red blood cell has one blue color dot, just one blue color dot, not more. So one here, one here, one here, one here. So what I want to tell you is that these are the Howell-Jolly bodies. And Howell-Jolly bodies are usually single in appearance. They are usually single because otherwise you'll see, like, look at this picture over here. There are multiple blue color dots. So this is very unlikely to be Howell-Jolly. Howell-Jolly has to be a single blue color dot. So we've learnt it as exam going students, always better to be focused. So happy and jolly to be single during the exam time. So happy and jolly to be single is how you remember it. That Howell-Jolly bodies are single in appearance. Next question that they ask you is, what is it made up of? It is made up of DNA remnants, nucleus, tiny bits of nucleus or DNA that has stayed behind. That is a Howell-Jolly body. And what are the two places where you see it? One very famous anemia, that is megaloblastic anemia, and second situation, post-splenectomy. So these are the two histories that you'll get. Whenever you get this picture, you will get either a history of B12 deficiency, or you'll get a history saying that the patient had a splenectomy 10 years ago or 8 years ago or 20 years ago, and this is what you're seeing in the peripheral smear. So that's a Howell-Jolly body. First wala ho gaya. Let's move on to the second one. The second one that you see over here. Over here, guys, first thing that I made you analyze was that how many blue color dots do you see? You see multiple blue color dots. So multiple wala will not be Howell-Jolly body. Howell-Jolly body was the single one, right? Multiple dots one, the multiple blue color dots, when you start getting them in the RBCs, they are likely to be iron. And these iron bodies are known as the Pappenheimer bodies. So my common sense and my general understanding tells me that whenever there will be more of iron, think of all the situations where iron is more. And one very classical situation that comes to our mind is sideroblastic anemia. See, it has the word sidro in it. Sidro means iron, right? So this is that anemia where the iron is going to be more. Yes, you are right. Pappenheimer, that's the name. These are Pappenheimer bodies. They are made up of nothing but iron. And which anemia? Sideroblastic anemia. Can you tell me one more anemia? Maybe that patient gets so many blood transfusions that iron automatically increases in that patient. What is that situation where the blood transfusions are too many and iron content increases because of that? So do we have thalassemia? Do we have thalassemia also as one of the conditions where iron overload can happen? Yes. So I think this is something that should come to your mind, and I see a couple of other doubts from Dr. Swati and others. I'll be coming to your doubts also. But think of first where iron is coming, and no, this is not basophilic stippling. I'll be coming to basophilic stippling in 5 minutes or so, but these are just Pappenheimer bodies. I can see 4-5 bodies inside every red blood cell. So iron more hoga, like sideroblastic anemia, thalassemia, that is Pappenheimer body. Now someone asked me that, ma'am, if this is a case of sideroblastic anemia, where are the ringed sideroblasts? That's a question that I've got, a very valid question. But before asking, if you just dissect what you've just asked me, you'll get to know. See, there are two terms that you've put up right now. The term that I was teaching was Pappenheimer body. And the doubt that you have asked is ringed sideroblast, because your concept is also right that both of them are seen in sideroblastic anemia. Agreed. Because Pappenheimer body is also made up of iron, ringed sideroblast is also made up of iron, and both of them are seen in the same anemia, that is sideroblastic anemia. But did you analyze something, that when you're saying ringed sideroblast, you have used the term blast in it. Means you have used the term not of a mature red blood cell. You are saying iron will be seen in the red blood cell precursors. Where do I see the red blood cell precursors? In the peripheral smear or the bone marrow? red blood cell precursors. Precursors are usually seen in the bone marrow, right? So ringed sideroblast is something that we will be seeing in the bone marrow because that is where the blasts are, that is where the precursors are. Versus Pappenheimer bodies, I am saying that you see them in the mature red blood cells. Mature red blood cells are something that you'll find in the peripheral smear. So over here, the picture that I showed you was of a mature red blood cell. This is a peripheral smear, mature red blood cell. So you expect to see which form of iron? Pappenheimer bodies. If I would have shown you a bone marrow sample of sideroblastic anemia, in the bone marrow sample, you would have seen the ringed sideroblast. So I hope that is okay with everyone. Okay. Two, three more questions which I've got is the picture is like a spotter or will it come with a clinical history? Dr. Nitin, either is possible. These pictures have come as direct spotters also. These pictures have come in the form of clinical histories as well. So either of the two is possible. With these pictures, you cannot predict that where will the examiner go. But the concept is that either whatever way the examiner gives it in, if you know your images well, you will always consider it as a spotter. Then you save on a lot of time of reading the questions in that case. So yes, guys, let's repeat. The first one that we've done was Howell-Jolly. The second one that we've done are Pappenheimer bodies. Now let's come to the third and the last one, the different one. Do you remember the different one? What was the stain? Because now I'm going to talk about Heinz bodies. And the stain that I've used for staining Heinz bodies is crystal violet, which is a very famous NEET PG question. Crystal violet for staining Heinz bodies. First, let's do our theory a little. Theory में क्या है? Where are Heinz bodies seen? Heinz bodies are seen in G6PD deficiency anemia. And what exactly is Heinz bodies? So you'll say, ma'am, when G6PD is deficient, then the hemoglobin becomes denatured. So that denatured hemoglobin is nothing but Heinz bodies. Heinz bodies is denatured hemoglobin, and that is the catch over here. Denatured hemoglobin you cannot see on a regular Romanovsky stain. If you want to see denatured hemoglobin, if you want to see Heinz bodies, you will have to use a special stain that is crystal violet, and that is what I used over here. And now can you see in these RBCs that I'm encircling, can we all see one blue color dot in every one of them? One blue color dot. So you came to a conclusion that Howell-Jolly body was also single. But what was the stain that I was using in Howell-Jolly body? It was a routine stain, the Romanovsky stain. Heinz body is also a single body usually, but it's stained with a very different kind of a stain, and that is crystal violet. So I hope the difference is clear. Let's do a very quick recap, guys. Quickly tell me this body, this one, which is a Romanovsky stain and multiple blue color dots, that becomes the iron wala. So what can I label this at? I label this as the Pappenheimer bodies. Next one, this is also single blue color inclusion, and this is also single blue color inclusion, but this is the reddish stain, the Romanovsky stain. So I label this as the Howell-Jolly bodies, whereas the other one, which is this special stain, the crystal violet stain, I label that as the Heinz body. I hope this aspect is okay. Okay, so and I have another question, that where did the bite cells go? Well, honestly speaking, G6PD deficiency, I'm not dealing with that today because bite cell, today I'm only talking about inclusions. Bite cell is not an inclusion. When you're talking about a bite cell, you're talking about a difference in the shape. So tomorrow I'll be showing you all those bite cells and all those different shapes that we have. But as far as your theory goes, you are absolutely right that G6PD deficiency apart from Heinz bodies shows us the bite cells as well. Now let's see some other rare questions, like Dr. Akshay is saying hemolytic anemia shows Howell-Jolly bodies. It can. Hemolytic anemias can also show. So see, for everybody, if you come down to reading like all the 10 causes, then everything is possible. But we have to focus on the most important causes on which we get a question. So yes, Howell-Jolly bodies have been reported in hemolytic anemia undoubtedly, but unlikely to get a question on that. So these three are done, and I hope the confidence has come on how to identify these three bodies, because now I go on to something very simpler, which is very easy for everyone to analyze, and that is a Cabot ring. So what is the next inclusion? You say there's a big red blood cell over here, and inside that red blood cell you have this figure of 8 kind of an appearance. Similarly, you have a red blood cell over here, and you have this round kind of an appearance over here. Right? So what did I analyze? Either the shape of the ring is a O, or it's an 8, or it can be any shape. It can take the shape of a B, it can take a shape of the D. So my first concept is that a Cabot ring necessarily is not figure of 8. Cabot ring can actually take any possible shape out here. So why is that? What is exactly a Cabot ring? So two questions that you get. Where do I see Cabot ring? Cabot ring is seen in megaloblastic anemia. Cabot rings are seen in megaloblastic anemia. And second, what is it made up of? If someone asks us the composition of Cabot ring, you'll say, ma'am, it's a very, very thin thread-like thing. That's why the thread can shape it, can shape up into anything. It can become an 8, it can become O, B, D, any shape it can take, because it's a very, very thin thread, and that is nothing but a mitotic spindle. It's made up of nothing but a mitotic spindle, and I think everyone knows and has already answered that this mitotic spindle is very, very rich in arginine. It is going to be an arginine-rich mitotic spindle. So please remember, it's a mitotic spindle which is very rich in arginine, can take any of the shapes, known as a Cabot ring, and seen in megaloblastic anemia. So if I ask you what are the bodies seen in megaloblastic anemia, you'll say bodies of megaloblastic anemia are Howell-Jolly bodies. And what are the rings that we see? That is the Cabot ring. So if I give you such kind of a question, look very carefully. That's a small mini test for you. This is a red blood cell. This is a peripheral smear that we have. And what is A? What is A? This round thing, big thing over here. So what is this O shape, oval shape kind of an inclusion? Will you label A as the Cabot ring? Very good. So if you're thinking of Cabot ring, you have started thinking of megaloblastic anemia. So what is this single blue color body over here in that case? The same red blood cell, showing you a Cabot ring also and showing you a blue color dot. So the B will then become the Howell-Jolly body. So this is actually a case of megaloblastic anemia. This is actually a case of megaloblastic anemia, and this is a very rare picture because in the same red blood cell, you're very interestingly seeing a Cabot ring also, and you're seeing a Howell-Jolly body also, and I hope the distinguishing fact is clear. Now, many of you had a query about what is basophilic stippling, and many of you keep asking me in different classes also that, ma'am, what is basophilic stippling? Where do we see it? So let's analyze that also. That is also an inclusion only. Say you have a red blood cell over here, there are 2 over here, and there are so many over here. Everything you can encircle over here. All of these over here have blue color dots. So that's the meaning of the word stippling. That's the meaning of stippling. Stippling means it's not going to be 1, 2, 5, 6, 7 dots. No, stippling means it's going to be all over diffusely dot 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 kind of thing. So someone, I think Dr. Swati, you had asked me some time back that ma'am jo Pappenheimer bodies hain. Pappenheimer bodies are also multiple. But how many? 4, 5, 8, maximum 10. How many blue color dots will you see? The entire red blood cell is not stippled. But when you talk about basophilic stippling, the concept is that the entire red blood cell will be covered with those blue color dots. Multiple stippling. That's the meaning of the word stippling, to be honest. ठीक है, तो अब 2 टाइप का है. One is a fine stippling and one is a coarse stippling. What is it made up of? Basophilic stippling is nothing but precipitated RNA. Basophilic stippling is nothing but precipitated RNA. That's the composition. So either it can be fine or it can be coarse. Fine will be small blue color dots. Coarse will be big blue color dots. Where do I see fine basophilic stippling? One one is megaloblastic anemia. वो हर जगह fit होता है. But one very important cause on which you'll get an exam question is thalassemia. Thalassemic patients show you basophilic stippling. That's an exam question which you need to learn. And someone again asked me for the PDF, I think, in between. Don't worry, PDF mil jayega. Abhi just focus on the concepts that we are doing. So yes, basophilic stippling is seen, fine basophilic stippling is seen in thalassemic patients. And where do we see coarse basophilic stippling, which is very big blue color dots? There are 2 things that we need to remember for that. And anyone who wants to give that an attempt, any poisoning on which you get questions that coarse basophilic stippling is seen, lead poisoning. there is something known as lead poisoning, and other than lead poisoning there is also something known as 5' nucleotidase deficiency. These two questions are very important. Which enzyme deficiency? 5' nucleotidase deficiency. And which poisoning? Lead poisoning. These are the two causes which are going to result in coarse basophilic stippling, and thalassemia is the cause, most important cause, where we get to see the fine basophilic stippling. What is stippling? Means the entire red blood cell will be covered. And finally, what is it made up of? It is precipitated RNA. I hope up till now and all the concepts are clear. I'm left with two more. These are different hemoglobin inclusions. Matlab hemoglobin kya hai? I think everyone has heard of something called hemoglobin H disease, and then there's something called hemoglobin C disease. So now you're saying that, ma'am, we've done all those bodies and all. Now let's say that different hemoglobins, what kind of inclusions can they create? And these are the last two that we have for the day. Then we'll do a quick summary and we'll wrap up the session. So firstly, let me check your theory a little. When I say HbH disease, what disease am I actually talking about? What is the hemoglobin disorder that we are considering, guys? Yes, so very good. So that's amazing. And before I begin, Dr. Nitin has a query. Is lead poisoning also a type of sideroblastic anemia? Yes, of course. Doesn't lead inhibit enzymes like ferrochelatase and all? So lead poisoning is also a very common cause of sideroblastic anemia. Certainly agreeing with you on that. Okay, so everyone's agreed with me on one thing, that HbH disease is a type of alpha thalassemia. When we talk about alpha thalassemia means alpha chains are not there. That's the concept, right? Alpha chains are not there. So how many genes are deleted that HbH disease will occur? So let's go a little bit into theory and find out. Normally, when I talk about a normal person, thankfully like you and me, we have 4 alpha genes, and obviously we don't have any problem. We are totally normal because we have 4 alpha genes that are present in us. However, there are some people who have alpha thalassemia, like one alpha gene got deleted, one alpha got deleted. They don't have much of a problem, they are asymptomatic. Then there are some people in whom 2 alpha genes get deleted. When 2 alpha genes get deleted, these patients are known as alpha thalassemia trait. These are alpha thalassemia trait patients. Next, when 3 alpha chains are deleted, when there is 3 alpha deletion, that is when, guys, we call it the thing that I'm showing you over here, HbH disease. So what is HbH disease? Please remember that HbH disease will be when there is a 3 alpha deletion. So tell me one thing, guys. Alpha deletion ho chuka hai. There are 3 genes which are deleted, which basically means that alpha chains are now almost not there. Alpha chains are very less. So does the beta chain have anyone to bind with? For making hemoglobin, don't alpha and beta combine? Don't I have alpha 2, beta 2? Isn't hemoglobin made up of this? Adult hemoglobin is alpha 2, beta 2. But alpha 2 chains are not here any longer. Alpha 2 chains are not here any longer. So what will the beta chains do? Beta chains will combine with their own selves. Earlier there were 2 beta chains and 2 alpha chains. Now these 2 alpha chains are not there, so the beta chains say that we'll make tetramers. We will start making tetramers because we don't have anyone to bind with. And that is what happens in HbH disease. Because the alpha genes are deleted, the beta 4 tetramers are formed, and they give the formation of what you're seeing over here. And this is referred to as, it looks like a golf ball. It looks like a golf ball inclusions. That's the name that is given to it. So if I have to do a full summary right now, what is HbH disease? It's a type of alpha thalassemia. How many genes are deleted in HbH disease? 3 genes are deleted in HbH disease. So alpha chain production has gone for a toss. It's not going to happen. The beta 4 chains are then going to give me these kind of golf ball inclusions. But if I wouldn't have given you any history, ये थोड़ा थोड़ा basophilic stippling जैसा है. Yes, this is basophilic stippling. You could have said, okay, ma'am, this is also ... everywhere. What if I call it basophilic stippling in the exam? But then again, you're missing out on something. What is the color of the smear that I have shown you in basophilic stippling? Have I shown you a very reddish color, red blood cell? Because I have used basophilic stippling, normal stain पे दिखता है. Basophilic stippling is a routine Romanovsky stain kind of a picture. You don't need any special stain for it. But when you are seeing golf ball inclusions, what are you trying to see? You'll say, ma'am, I'm trying to see the beta 4 tetramers. I'm trying to see hemoglobin. I'm trying to see the chains of hemoglobin. So that I cannot see on a regular stain. For that, we've used something called new methylene blue. That is why, can you see the entire slide has a very bluish kind of a tinge, because the stain that I've used over here is new methylene blue. So remember, all these things that I've highlighted in yellow are questions. Quick recap: HBH disease, alpha thalassemia, how many genes deleted? 3 genes deleted. Beta 4 tetramers give you what kind of an appearance? Golf ball inclusion. On which stain? On new methylene blue stain. ओके, नेक्स्ट क्वेश्चन. आर गोल्फ बॉल नो 4 अल्फा जीन डिलीशन में नहीं होता. 4 अल्फा जीन डिलीशन का सैंपल ही क्यों आएगा? 4 अल्फा जीन डिलीशन पेशेंट सर्वाइव ही नहीं करता. 4 अल्फा जीन्स, if someone is, there's a child who has all 4 alpha genes deleted, that child lands up in an intrauterine death. That is not even a live birth, that's a stillbirth. It's an intrauterine death. This situation is not compatible with life. So you will actually not get to see a blood sample only of such a patient, because this patient is not going to survive in that case. Even if from academic interest you are wanting to ask me, golf ball inclusions are not seen with alpha 4 deletions. They are only seen with 3 alpha deletions. Okay, so next question from Dr. Akshay is new methylene blue a supravital stain? Of course, yes. New methylene blue kahin aur padte hain? Any other thing which is stained with new methylene blue? The very famous reticulocyte, and over there we study that new methylene blue has supravital properties. So yes, it's the same new methylene blue that I'm talking about. Okay. Next I have another question about HB Barts. Yeah, you're right. This is also known as the 4 alpha gene deletion is HB Barts. That has gamma 4 tetramers. I agree with you on that. So coming back, and the last one, HBC crystals. So HBC matlab hemoglobin C. Like you have different hemoglobins, na? The adult hemoglobin. Then some diseases are there where we have sickled hemoglobin. Similarly, there is a disease which goes by the name of HBC, hemoglobin C disease. And hemoglobin C has a property that it tends to crystallize. That's how I've learned it. Hemoglobin C crystallize kar jata hai. And when it crystallizes, it forms these kind of inclusions in the red blood cell. So it's very interesting to see that you are seeing these kinds of, the hemoglobin is crystallized into one area. See, the rest of the red blood cell has become white because all the hemoglobin is crystallized here and here. Similarly, all the hemoglobin is crystallized here and here. Same way, all the hemoglobin is crystallized here. So what I can realize is that this is the hemoglobin C inclusions, which is nothing but the hemoglobin that has crystallized. Having said that, most of the hemoglobin I am seeing inside the cells, intracellular. Means if they ask you that hemoglobin crystals are intracellular, you will say yes. Can they also be lying separately? Correct. So they can also be extracellular. Hemoglobin C crystals which crystallize can be intracellular plus extracellular, and that was the summary of everything that you needed to know for today, only for today, because shapes kal padenge. So quickly, if you see a ring like structure, that happens to be a Cabot ring. If you see multiple dots, that happens to be Pappenheimer iron bodies. If you get to see a single blue color dot, that is Howell-Jolly bodies. If you see stippling all around, that is basophilic stippling. If you see the presence of these kind of inclusions, the hemoglobin inclusions, that is hemoglobin C disease. And if you see the golf ball kind of inclusions, that is hemoglobin H disease. So that is the plan that we had for today, and all the inclusions are done. Yes, I have some, one more doubt that which someone had asked me, what is parahemophilia? Although it's not related to today's session by any manner, but we will just quickly talk about hemophilia. Like any other clotting factor problem, it is parahemophilia, para 5 penta. That is how we learn. Para 5 penta. So that is a factor 5 deficiency that is there. Factor 5 deficiency, that is parahemophilia. Okay. Yes, so I guess everyone's done with this session, and we have another trial kind of a session today. Let's see how well does it go in our learning. I'm going to circulate. It's 2:30 right now. I'm circulating one PDF in exactly a minute. I'm circulating it on Telegram. Download that PDF. Keep it in front of you. I'll be joining you in the open house session on the Unacademy app at 2:40 p.m. And in 20 minutes, we'll finish off that PDF. I'll just speak it out, give you some clues, give you some mnemonics. We'll give you some blank slides also, which you can fill up. Audio session only. 20 minutes rakhenge, and by 3 o'clock, we'll wrap it up. And our CD marker quick revision should also be over. And it's a trial session because after this, in the open house, I want a feedback from you guys whether audio method of learning is helping you. Sometimes it has helped a lot of students. So if it works for you, we'll plan more sessions going tomorrow onwards as well. So yes, thank you so much. And Dr. Someone had asked me about AIHA. We'll certainly have a session when we talk about hematology in our Kickstart morning sessions, the early morning sessions that we have on the app. I'll put up Hemat for sure, and then I'll be talking about autoimmune hemolytic anemia under that. Okay, so yes, thank you so much for joining in, guys. Take a 5-7 minute break, and let's meet again at 2:40 on the app for the open house session.